Hi, I'm Lorin Nicholson from Advanced Remedial Therapy, and welcome back. Today we're going to be doing another technique that's really great for a number of different problems that people suffer, whether it's from headaches, neck pain, upper back pain here, even right out across into the shoulder pain. These couple of stretches and release techniques are really good for kind of relieving pressure off all of those areas. So we've got Tom now as our specimen today, and we're going to just start with a couple of very simple stretches, and we're going to just cradle the head. So if you get someone lying on their back, just cradle their skull just in a nice comfortable spot here. You'll notice I've kind of almost got a bit of my thumb or my forefinger right down along the traps here, and that's just so I can actually feel the amount of tension on the muscle tissue itself when we do the stretch. And the thumb here is more for control. Just gently on here, though. Don't go sort of using your fingertips. It gets really uncomfortable driving a fingertip into someone's head. So just a nice, firm but comfortable hold. And then I'm going to use my other hand and just rest right out on the deltoid here. And I'll just take up the tension. I tend to take up the tension first with my hand on the deltoid. Then I slowly... So take up the slack with the deltoid, they're stretching away, and then I'm going to just slowly stretch, and I use the even pressure along my thumb and my forefinger to gently just push away with the skull. I'm pushing away here to the left in my case, and see, and you don't push really hard. It's not about kind of forcing something to happen. You're encouraging it to happen. And so I'm now just holding this pressure here, and when you feel the tension pull up, don't just keep pushing, just stop, relax, just be patient. A lot of these techniques require patience, and let it go. There we go. And then when you feel it just stretch as far as it's going to stretch, we then let the pressure off the shoulder first. I always grab them on the other side, just gently there, and just move their head just slowly back this other way again. So there's always support. What we're trying to do here is, I'm the one in control. I'm not making them move the neck, otherwise they're tensing muscles up. What are we trying to do? We're trying to release muscles, not tense them up again. I'm already feeling that there's a difference here on the right side compared to the left side. And so some people, just be careful. If someone's in pain when you're doing this, then just back off. They may need some other soft tissue work, some massage and some other work done before you can actually do some of these techniques. I'm actually feeling some restriction up in here, up in Tom's upper neck here on the left. Feel that in there, Tom? And so this stretch is going to really be helpful for these, what we call lateral tissues, splenius, right down into the scalenes. If you're a massage therapist or a physio, you'll probably be aware of these. They're the muscles that run right through the lower part of the cervical spine here and attach onto the rib cage in under the collarbone. This is where all the nerves come from that go down into your arms, the brachial plexus. And so this stretch is really good to kind of open that up and allow that nerve supply and blood supply down to the arm work really well. Now you'll notice if I do it this other way with my hand this way, I find it a bit hard to sort of pull against myself with my right hand to stretch the neck. That's why I cross arms. I use my left hand, in this case now, on Tom's head, and I use my right hand now to hold his left shoulder. Again, remember, take up the strain, just push it until you feel okay. I've taken up the slack, and now let's just gently, once again, even pressure on your hand, and just feel very sensitively with your thumb and your finger how readily these muscles are willing to let go, and just take it slowly and patiently. There's another technique that we're going to show people in another treatment, which is really an advanced version of this particular stretch that we're doing. Remember, let go of the shoulder, cradle, and bring them back into a neutral position again like this. So there's two great stretches. One final release technique we're going to do now is going to impact more the cervicothoracic area and down into the upper thoracics, right between the shoulder blades. And we're going to, again, cradle the skull, the base of the skull. Your hands will your palms of your hands will hook really nicely just into the base of the skull here. And I'm going to now lift and rest my elbows on the table. Or if you're at home, you can do it too. It's on the bed or on the table. A firm surface is always a little bit better. If I go this side so you can see my face a little bit better with the lighting. And what we're doing here is stretching the muscles right from the base of the skull all the way down through between the shoulder blades. Can you actually feel that pulling a little bit, Tom, down between your shoulders, down your back a little bit?
Yeah, right in between my shoulder blades, I can feel it pull the muscles.
Yeah, yeah. And so we're not only impacting the muscles here, we're also impacting joint movement and mobility, and the fascia, which is the elastic tissue that kind of wraps around all of this. It's like a spider's web of elastic tissue that connects all of these muscles and parts of the body together. And so it's just stretching that fascia and muscle tissue all the way down. But if we just sit here, what you'll find is it'll just, you'll think, gee, nothing's happening. But it is stretching, and after a few minutes, you'll actually notice their shoulders and their neck will kind of slowly sink downwards towards the table. That means that that muscle tissue and fascia is finally releasing and stretching. I can actually feel Tom's slowly letting go. Are you feeling the same pressure between your shoulders now, or has it eased off?
It's the same right now.
It's the same right now. So I just hold that a little bit longer. And of course this is only one of many techniques that you may need to use on somebody to actually release this area properly. Again, you notice how I'm just swiveling my hand here, keeping my palm of my hand cradling the occiput, the base of the skull, and that way I can securely and safely lower their head back down again. And once again we might finish with just that traction by pulling the head, cradling it with your hand. I'll just do it on this side here too, cradling the base of their skull, because that just gives you something to hook onto with your hand, and then gently but firmly applying a little bit of pressure backwards there, just to stretch and open up this whole neck and cervical area. It's a good technique just for releasing that. Simple, but can be quite effective, particularly for these lower neck, shoulder, mid-thoracic areas. So thanks again for joining us, and don't forget to subscribe to our Facebook page and also to our YouTube channel, which is Advanced Remedial Therapy. My name's Lorin Nicholson, and we'll catch up with you next time.